Good morning, everyone, and thanks for joining us for QI Power Hour this morning. This is Chelsea Schwartz with the Saskatchewan Health Quality Council here in Saskatoon. For those of you joining us for the first time, QI Power Hour is a free monthly webinar learning series hosted by the Health Quality Council. We bring together improvers from a variety of sectors with an interest in improving health to learn about quality improvement related topics. All of our sessions are recorded and available on the HQC website following the event. Feel free to share these recordings with colleagues who are unable to join us in person today, and feel free to check out past sessions you may have missed.
Oh, sorry. I think I put it on the actual backpack. Jeepers. Oh, sorry, you guys. He was on the job here.
Jocelyn, I think that we can hear you. I'm not sure why you haven't been muted. I'll just get you to mute your line. Thank you. While you're on the Health Quality Council website, we also invite you to sign up for our distribution list to ensure you receive regular invites to all of our upcoming QI Power Hour sessions. Over the last year, we've been excited to see the continued growth of QI Power Hour throughout our home province of Saskatchewan, as well as within Canada and even abroad. Thank you for spending an hour of your time with us today and for your commitment to ongoing learning to improve the systems that you're each part of. We're looking forward to your engagement and participation on the webinar today, and we encourage folks to share their questions and insights during today's sessions by making use of the chat function. So you can access this chat function by clicking on the message bubble towards the bottom of your screen. This will launch the chat panel on the right-hand side of your screen. We encourage you to share your questions, comments, and ideas throughout the presentation, and we'll have some dedicated time to Q&A at the end of today's session with Colleen. So please send your questions to all participants so that we can all join in the conversation. Let's take a moment right now to practice this function by typing in the chat the name of the organization that you're joining us from today. So we'll just give folks a couple minutes to do that. Great, well, you're getting your, thanks, Jeanette, Saskatchewan Health Authority. While everyone is typing in the name of their organization, excellent, it looks like folks have gotten the handle on it and see where that chat function is located. Welcome, everyone. We also invite you to tweet out about your insights and reflections during our session today. You can use the hashtag QI Power Hour and the handle HQCSask. And you'll also see the Saskatoon Poverty Reduction Partnership handle there as well, so End Poverty YXE. And with that, I'm delighted to welcome Colleen Christopherson-Cote from the Saskatoon Poverty Reduction Partnership. So we'll pass it over to you, Colleen.
Awesome, thanks so much. Great, so thanks for having me. It's like, I'm a little bit stressed out, but I'm also really quite excited to be sharing this work in this forum. The Saskatoon Poverty Reduction Partnership has been working on this work for almost 18 months, and so we're in this sort of awareness and implementation phase, and so it's great that we can spend some time together to talk about it. I need to figure out how to move the slides forward. So I just wanted to give a little bit of welcome. I didn't know for sure where folks would be coming from, whether it would all be from Saskatoon or Saskatchewan in general, and so I wanted to take a moment just to take a step back and reflect on the fact that the SPRP meets and works within Saskatoon, and Saskatoon is a community rich with history located on the South Saskatchewan River in Saskatoon in Treaty 6 territory in the homeland of the Métis. Part of this work, we acknowledge the people that played a key role in establishing this community over time and respect our ancestors and cherish those relationships as we work together on a path of reconciliation and learning to end poverty in Saskatoon. This partnership has been in existence for about 10-ish years and has been working on a variety of different municipal, regional, provincial, and federal policy practice and local programming. I've been the coordinator in a part-time capacity for about 7 years. The slide deck, I think, will probably be available as well, and so I've linked some of the historic work in the slide deck so you can get access to those hyperlinks. But this team was responsible for the work around poverty costs, the creation of living wage YXE, and now today launching the 12 bold ideas to eliminate poverty. I also have a couple of acknowledgements. The work of the SPRP is rooted in the concept of nothing about us without us, and the team of people with lived experience spend countless hours sharing their stories, and it's important to note the bravery of those stories and their willingness to share them. I think good policy and practice cannot be created without the informed stories of people who are ultimately impacted by those policies and practice. And then as a side, also within the document while we were building it, it was really difficult to find images. And so when I was looking for images of Saskatoon specifically, a lot of the work of Jordan Cooper popped up. And so he recently passed, and I had connected with his family for explicit consent to use the photos of his work in our document. And so all of the photos of Saskatoon are the property of Jordan Cooper, and we're appreciative of his willingness, his family's willingness to share his work with us. Okay. A little bit of the agenda. So a quick overview of who the SPRP is, mainly because I figured there are people who didn't know who we were. A quick look at the bold ideas. In the invitation to attend, I asked that you take a look and read through the document. I'm not going to spend a lot of time going like page for page and really diving into the content, but I would invite you to ask questions in the chat. I will also get back to you after if I can't get to those questions right away, specifically about content. And I will kind of pay attention to the questions as we move through. If there are specific questions about what I'm actually talking about, then I'll try and address them. And then I'm going to look a little bit more about methodology. It's interesting, as a community practitioner, I'm realizing more and more that the relationships that I have in academic and in government and in more sort of rigid research conversations, there's a real ability for people to see the intersection between community practice and research methodologies. And so I'm going to spend some time talking specifically about the lessons that I've learned as a coordinator around research methodology, but also the impact that my relationship with QI professionals has had over time, and how we ended up having a more solid, effective 12 Bold Ideas document because of those relationships. We'll talk a little bit about the complexity of the solution, and I'll have a little bit of a challenge for you to look at the way you do business. Okay. So the SPRP, this is kind of, I also really like diagrams. So for those of you who know me, have seen lots of diagrams. I was just joking, I brought my notebook, it's full of diagrams. I tend to learn better when things are visual, and so I like to make pictures of the way we do work. So this is currently how the SPRP is structured. The big sort of creamy colored circle is the leadership team. It's made up of about 75 partners that come and go and work on things as energy is there. It's a constellation model, and so the coordinator holds the pieces together and works to make the work move forward. At any given time, right now there's probably too many action teams, but at any given time there's probably about 6 or 7 action teams working. You'll see throughout the course of the next steps that there's a lot of action teams bubbling to the surface, probably because we have 12 bold ideas to eliminate poverty, and there's lots of action associated with that. And then the red pieces are funding, and so you can see funding has a backbone, so the work of the SPRP is funded and backboned by core partners, a collaborative of core partners, but also action work is independently funded outside of the SPRP work. And so we work under this modified collective impact constellation model. And we used to work just to catalyze, convene, and coordinate, but I've recently added the word collaborate into that because of what's going on with the 12 Bold Ideas. And so I spark work, I bring people together, we work together, and then I keep my sort of finger on the pulse around acting as a hub of activity. The collaborate piece was added particularly because things will arise and people will think, oh, we should work on this, and we often don't stop and take a reflection as to whether or not other people are actually working on it. And so we try to figure out how we can connect the work in that way and work in a collaborative model before we start trying to spend energy duplicating other people's work. And so the historical pieces of the SPRP, like I said, it's been in existence for about 10-ish years. Historically, we were working on a call to the provincial government to have a Saskatchewan-focused poverty reduction strategy. Some would argue pre-2017 that we were the only province in Canada that didn't have a provincial strategy. BC, we may be able to fight back and forth around which one came first or who doesn't have one right now. But we do have a provincial government poverty reduction strategy. And so when that strategy fell, the SPRP redefined sort of what it was working on. And at the same time, we had a changing political landscape in Saskatchewan and in Saskatoon specifically. When the federal government changed, we also had a municipal government change. And so when that happened, the leadership of the SPRP thought, well, with a new provincial strategy, we should start looking at what's going on federally and what we could work on municipally. And the municipal government change was really probably one of the biggest drivers because we had a fundamental value system change with the municipal government change here. And so the new mayor and the new councillors redefined the way they were looking at community safety and well-being, and this work fell into that re-envisioning of what was going on from a municipal perspective. This strategy, though, is not a City of Saskatoon strategy. It is a strategy for Saskatoon as a collective and as a community. But what we did determine was that we needed to look at Saskatoon, the geographic space of Saskatoon, and figure out how we could eliminate poverty within Saskatoon's borders. That being said, the 12 bold ideas could easily be replicated across Saskatchewan or even across Canada. In the right spot. So what we did find was that, and we knew this kind of going in, but we knew that because poverty is such a complex system, we needed to make sure that we were mindful of the fact that poverty looks different for a variety of different people. We also knew that in Canada, but I mean in the world in general, poverty shouldn't exist. And if we're looking at poverty from a human rights perspective, then we're talking about an argument that suggests that poverty is a direct consequence of government policy or the government inability to make sure that policy practice and implementation at the ground is working properly to ensure that there's a process and practice of equity. And so we're looking at, you know, do we embed equity and do we embed human rights language is it a single pillar within the document, or is it an overarching? And so we decided that because human rights, reconciliation, racism were such large, complex pieces to this puzzle, that rather than creating them as individual pillars within the document, we would have an overarching umbrella to make sure that we made human rights and racism a key piece. We also need to note that moving people out of poverty in Saskatoon is not about just simply giving people more money, that it's a much more complex piece than that. And so we need to look at social isolation, trauma, personal circumstances, the social determinants of health, and all of the intricate relationships from an individual and from a system perspective. Like I said, racism was one of the things that had been flagged by the team as potentially a pillar within the 12 bold ideas. But because every time we talked about a sector, education or health or whatever, racism played, systemic racism and the historical traumas associated with race in this province showed up. And so we decided rather than embedding it, or rather than creating a single pillar, we would embed it throughout. And so when you read the document, you'll see pieces emerge, particularly within the stories around systemic racism. There is clear connection between racism and poverty. There is an overrepresentation of cultural minorities, racial minorities, ethnic minorities, and the connection to lack of education, good housing, mental health, trauma are disproportionately impacting people who are from a different ethnic or cultural background. It's also interesting when we started looking at systems and the way they worked, that the systems that are designed to help people are often perpetuating systemic racism, and those policies and practices that have been created, and some of them created 10, 15, 20, 30 years ago in a different colonial construct than we're in right now, have never really been modified. And so we have discretionary implementation of policy happening or legacy implementation of policy happening. And so all of those are rooted in a system that perpetuates racism, and we need to start looking at the way we can dismantle and disrupt those systems. And Saskatoon, and for those of you who are across Canada may have seen this as well, I think when we're in Saskatoon or in Saskatchewan, we don't realize the impact that we're having from truth and reconciliation path or journey. But we are actually leaders across Canada around the work that's going on with Reconciliation Saskatoon and the commitments to embedding the truth and reconciliation calls to action into the work, but also now the Missing, Murdered Indigenous Women and Girls Calls to Justice. And so with that new release, we'll be embedding that work and recognizing where poverty and the 12 bold ideas fall within those calls to justice. So, like I said, I'm not going to go into the great details of what the 12 bold ideas were. Interestingly, through the path, and I'm going to do some more methods in a second, but in the pathway, we talked to folks who had solid municipal plans up and running, so Vancouver, Edmonton, Toronto, Winnipeg, Halifax, Hamilton. And they all said to us, don't make a checklist that you think you can just implement and move on. They gave us 2 sets of advice. Don't make it too big, and make sure that you embed evaluation and methods into the entire process. And so we've been doing that. I originally wanted, personally, as the coordinator, wanted it to be like 3 bold ideas to eliminate poverty because I felt like that was more a tangible outcome. But as we built the data sets and talked to people and went through things, it grew to 6, and then it grew to 10, and then it grew to 13, and I was like, 13 is not a good number. And then we dropped a couple things, and it was 11, and then we decided on 12. So it was not, I mean, the actual picking of the 12 things wasn't really a rigid scientific process. But that being said, I feel like now that they're all out and we look at the intricate relationships and the complexity of the 12 ideas, we landed on something that's really good for Saskatoon. So the 12 ideas are income and the equitable distribution of wealth, the idea that people need to be able to build assets, and that when you live below the poverty line, you're actually penalized and sometimes criminalized for building assets. But those of us who live above the poverty line know that as soon as you build your first asset, it's a life-changing event for you. And so why is it that people who are below the poverty line are not allowed to and are criminalized in doing so? What's the role of social enterprise? And tied to social enterprise now is social procurement. And so what can we do to build capacity around social procurement? And also childcare, obviously, early years investment is one of those things that I could stand on a soapbox forever and talk about, but we will never move the mark on poverty in Saskatoon or in Canada if we don't start talking about investing in children. I would say 0 to 3 is predominantly the core area, but 0 to 5 or 0 to 8, birth to 8, and what the role of childcare can play in stabilizing opportunities for families to get access to other things like employment or education, which leads us to education. So that's the concept that kids K to 12, there's a post-secondary piece to education, but we decided that we would focus on pre-K to 12 and talk about what's going on in summer months and what's the role of the education system and how can we talk about dismantling the colonial industrial school model and look at it like what role is it playing in perpetuating poverty in Saskatoon. Healthcare, obviously, there's lots of health folks on the line. So right now, so in the document, it's talking about a call for a poverty screening tool to be implemented, essentially because health is often one of the doors where people walk in and get access to things. That's in process. It happens in a bunch of different jurisdictions across Canada, and it's underway in Saskatoon. But more recently, we've decided to look at the intersection between social determinants of healthcare, so the big population public health kind of work, and where it intersects with the delivery system. And so often when I'm working in poverty reduction, I'm not talking to health system delivery folks, and so that conversation has just emerged. Transportation, when we built this one, I thought this would be the biggest one that people would be like, what? But basically it's a call for making public transit free to use in Saskatoon. Not free to implement, obviously it's expensive to run transit, but the redistribution of budget allocations within systems to make transportation free. We find that people who are vulnerable and people who are marginalized in deep poverty don't have access to even the low-income bus passing. And so we're trying to create a situation where people don't have to prove their poverty, that people have worth and can do whatever they need to do when they need to do it. Number 8 is good food. So access to good food is obviously important. We have lots of food deserts and food swamps in Saskatoon. And so this is not a call necessarily for access to grocery stores, but actual like relationships, and it goes back to the concept of social enterprise and education and health. What's the role of all the systems in providing access to good food, and how can we make better use of space so that people can get access to food in their communities? Housing is also another one. Obviously, that's pretty obvious. I always think housing, income, or wealth and food are the golden triangles. When people get access to stable and secure housing and have a good, healthy food source and have enough income to live, then they can get other things. But when you don't have those three sort of basic needs, things start to fall apart. So the housing call within this one is tied to a lot of the work that's going on in housing in Saskatoon and across Canada for that matter, around decreasing homelessness and creating affordable housing structures. But more importantly, from a poverty perspective, we're talking about systems who are perpetuating housing and homelessness by releasing into nothing. And so we know that the core human service systems, corrections and justice, health, education to some extent, and social services, are creating systems where people leave what is essentially a treatment center or a foster care home or jail, and when that service is completed, there's no transitional piece for folks. And so people are slipping back into the cycle. Justice was a really interesting one because we didn't want to talk about social justice. We were looking at the intersections of social justice and the justice system. And so we looked specifically at what's going on with women and why are women incarcerated in Saskatchewan and Saskatoon specifically. And what's the impact of incarceration for women and apprehension of children and the cycle that creates. And so that's where that piece is leading. Literacy was tied specifically to the idea that not everybody, particularly marginalized or vulnerable families or people, can get access to standard education systems, and so those formal systems are often harder for people to get access to, and we want opportunities for people to get access to learning in a variety of different mechanisms that's within their abilities and barrier-free, but also that then agencies who recognize those learnings recognize the informal and non-formal structures in a similar capacity to formal. So if you take a class at Sask Poly in food safe handling and you get a credit for it and you go to a worker and you get support for that, or you get a check mark in your file for that, you should then also, if you took that same course with the same curriculum at a community-based organization, it should have the same clout or same impact for your work moving forward. So right now that doesn't necessarily happen. And number 12 fell in at the very last minute because every single person that we talked to, regardless of sector, regardless of socioeconomic status, said that we're creating systems that you just can't navigate. And so originally we said we need to build some navigation into the system. More and more I'm personally unpacking that conversation around, yes, we need to build navigation into the system, but we would love to build systems that don't need to be navigated. And so we're at a bit of a conflict there around how do we invest in navigators, but also make sure that systems realize that they need to move forward in a more barrier-free mechanism. So that's how they're all interconnected. It's interesting that the 12 ideas are not a checklist. So they're listed 1 to 12. They're not necessarily in any particular order. And they are not independent of each other. So we're very aware that when you make a change within one, or you talk about what happens, say in number 5, if there was a full year school year model, like what would it look like to use the school building as a community hub where you could have transportation and childcare and social enterprise and asset building and justice and everything all spaced in there. And so it's not designed, this document is not designed to be a checklist. It's designed to create an opportunity for people to look at the way their policy practice and implementation happens and where are the things that you could make changes or even celebrate if they're amazing, because there are lots of amazing things happening. Okay. Where's the thing? I lost my arrow. Oh, there's this little tiny arrow and I can't always find it. There we go. I think it's also important to take a step back and talk about lived experience. And so none of these ideas, like this is not Colleen's 12 bold ideas to eliminate poverty. We work extensively with a team of lived experience folks, and from a variety of different demographics, age, gender, socioeconomic status. We tried to collect as many stories as physically possible. And in the beginning, we thought we would input like quotes or more data, but as the lived experience team read some of the data, they decided that they really wanted to build a storyline through it, and so we hired a writer to go through the hours and hours and hours of transcripts of lived experience interviews and pull out the pieces and weave a story through in an archetype kind of story. And so that's woven through the document, and it's designed to challenge you. I feel like sometimes people were upset and angry about it and were skeptical that this could actually be happening. And so while it isn't a single family, the circumstances of the family that are woven through the document are actual stories, things that actually did happen, and are, in theory, completely realistic to happen to a single family in Saskatoon. And so rather than viewing the story with judgment or criticism, we encourage people to open their minds and think about it from and let go of the lens of privilege that often many of us with affluence working in systems have and don't necessarily even keep track of. So we also wanted to make sure that we made the market basket measure family alive. And so we talk about market basket measure as a mechanism to talk about poverty lines. We know that there's 4 individuals in that family, and so we wanted to put a face and a story to what a market basket measure family would experience living in Saskatoon. So how we came to it, the other thing that's interesting too is I personally in work straddle the academic, government, more rigid reporting systems and community. And it might be shocking to all of you to hear that community does not like to read methods documents that are 300 pages long. So rather than creating a 300-page methods document, which I probably could do, we created a little infographic. We kind of stole the idea from the federal government. They did the same thing. And so we tried to figure out exactly how many people were interviewed. I feel like the number of people, 350, is really is lower than I would have. It's lower actually now because we've done a bunch more interviews, so it's probably up and around 500 now, but individual voices, and we strive to at least have 10% of those folks self-identify as having lived experience. There are others, there's more than 10% who are living with poverty but don't necessarily self-identify. And then we try to figure out ways to encourage as many diverse voices without any barriers. And so written feedback, phone conversations, emails, interviews, conversations, one-on-one, sharing circles, you name it, we basically did it. We also decided that lots of people have done amazing work, and so we mined and stole stuff from other people's documents that were public access. And so I have a laundry list of documents that we can look at if you're interested in seeing that list. And it's growing because people keep releasing amazing work, and so every day it grows to new documents. But we also talked about relationships with other agencies and conversations with other governments, both other provincial governments, other municipal governments, and also the federal government. And then made sure, again, that the voices with lived experience who have complex and diverse needs had a barrier-free mechanism in which to provide their stories. Also, the SPRP is committed to resourcing people with lived experience, and so we have an extensive inclusion, creating a culture of inclusion guidelines where we support and resource people who are not necessarily supported and resourced like we are as professionals to come to a table and share their stories. So again, surveys and homework, team meetings. And so I wanted to talk a little bit about the relationship around quality improvement because I feel like this is a quality improvements power hour. And so I was lucky enough in the even pre-12 Bold Ideas to work with the quality improvement team from the Saskatoon Health Region, now Saskatchewan Health Authority, around looking at QI methods and how we might be able to modify them to look at community practice. And so I'll show you some diagrams later, but we did some modified value stream mapping. I really like process mapping. I'm doing a bunch of that right now. And then again around the visualization of all of this work, and so how do you create visuals that people can manipulate and use, and then we can build policy and practice off of those visuals. And then how do you take one-on-one qualitative data and use that to inform those processes as well. And so I spent a fair amount of time working with teams, QI teams, to do that, and now have this immense, not that I can't learn a lot more, but immense knowledge around what quality improvement could look like in community practice. So here's some ideas of process mapping. It's interesting when you build these kind of PowerPoints, I didn't even realize I had 3 process maps. I was like, oh, look, there's 3. So there's the first one in November 2017. I sort of built an idea around how are we going to get this information. In January, we modified it to actually include a process on how we're going to engage and what it's going to look like and where we're going to take other information from. And then in June, we looked at it again and built what actually created the framework. And so it's interesting even for me from a learning perspective to look back on those processes and think who informed the process map and how did that happen, and then how did a map like that ultimately lead to creating a document that's public and that's community consumable. Often I'm creating documents that are not consumable by community, and when we were building this document, the one learning from Edmonton was don't build a 500-page poverty reduction strategy that nobody will read. And so when we set out for the soft launch and sort of the validation piece, we kept it to 12 slides, which is like incredibly impossible. And then from those 12 slides, we built what is now the document. And I just wanted to share some ideas around, or share some of the examples around what the products look like. And so the one with all the stars is an early years piece, like pre-mapping or pre-12 bold ideas that I was working on with the early years partnership, and it is a culmination of all of the data around where we would go next. And so we create documents that look like that so that people can consume them and understand where we're going, but also that have some of the quality improvements methods in them, so starburst and goals and those kind of things are in there. The big one that's all lines and triangles and dots is the map that actually informed that one-page infographic. That map is, I don't know, I think it's about 17 feet long. There's probably folks on the call who were involved in the creation of this map. So that's the early years partnership map from work prior to this. But the work from the early years partnership informed the childcare and K-12 bold ideas. And so we basically looked at all of the mandatory touch points between birth and age 12 across human service sectors and identified gaps. And so then those gaps became the priority work areas. The one below that is right now a process map for housing, another contract that I'm working on, but also tied directly to this. And so it looks at how do folks in Saskatoon move from being unsheltered, and unsheltered loosely defined as homeless, street, rough sleeping, but also living in systems or precariously housed or unsafely housed or couch surfing. How do you move from that situation into a securely housed situation, and what are all the steps in between, and what are the barriers? And so that map, that process map looks at the barriers particularly, and so what we're doing is trying to figure out how do we create a coordinated access so that people are not released into nothing, and what's the role of community, but also what's the role of government policy and practice in preventing that. The big Venn diagrammy round thing is a look at how we're building an evaluation framework for the 12 bold ideas around market basket measure family. And so what are our basket of goods? How are they connected to the 12 bold ideas? And then the purple words are the provincial government's priority areas within the provincial government, Saskatchewan provincial government poverty reduction strategy. And the red ones are the federal government's goals for their poverty reduction strategy. So we're trying to align the work that we're doing to what's going on both provincially and federally, but also not losing track of the local context. And so now implementation is like endless. There are no ideas that are off the table, although there's capacity, obviously. And so the ideas around implementation within the document are what we landed on as a team, but that doesn't mean that there aren't a ton of other ideas out there that are equally important. It also doesn't mean that things that you're working on aren't important and aren't great, because they probably are. But what we're asking is, when you're working on something or you have a policy or practice process, is to think about the 12 bold ideas and whether or not the policy or thing that you're working on has a ripple out and it has an impact on one of the other 12 ideas. So if you decide to make a big change to the income assistance program, then how does that impact other things like access to housing or food or transportation, those kind of things. And so it's that ripple piece that we learned from Edmonton, Vancouver, and Toronto that they weren't tracking and have now sort of refocused that work around how intricate and complex the relationships are around policy and practice changes that are so important. And we're also, because poverty is complex from a systems perspective, but also from an individual perspective, often one or two policy changes will have a big impact as a collective, but also may dramatically impact individuals. And so I was recently at a meeting with ESDC talking about what's been going on federally, and I'm curious to know, as they raise folks above the poverty line, so folks that are teetering sort of in and around the poverty line, they raise those folks out of poverty and are creating a more stable middle class, but what is the implication of folks who are deeper and deeper in poverty? And so are the conversations and processes happening to pull people out of poverty who are sort of around the market basket measure line? Are those policies and practices actually pushing more marginalized people deeper and deeper into poverty? And so a look at the relationship between system change but also individual impact is a critical piece to the work that we've been doing. And so I think, maybe the next slide. Yeah, so then the next steps is, what is the SPRP working on? We have an implementation plan. I have some how to get involved and what's going on in the next slide. But really the question right now is, for us, is what should we be working on, and would it happen if we didn't work on it? But also it might actually be happening, and is it stabilized or is capacity built if we are tied to it? And so what is the role of the SPRP to catalyze, convene, coordinate, and collaborate around the 12 bold ideas? We've spent some time as a collective talking about where we want to put our energy, which action teams and which areas do we actually have levers, which ones do we just have to connect to other people who have the levers, income being one of the biggest ones, right? SPRP has no capacity to move the levers around income, but we do have capacity to make collaborative relationships between the folks who do have those levers, and to talk about this work and why equitable distribution of wealth is a critical piece to moving people out of poverty, and what the role is in the policy and practice around income to do that, which is also tightly tied to asset building. And so what are the relationships between ability to build assets around the equitable distribution of wealth? And then from every time I go places and talk, it's a challenge out to folks, right? So you take some time to read through it and think, are there things that I didn't know are happening? Are there policies and practices within my work or within even my personal life that I are connected to that need to be redefined or looked at through the lens of these ideas? What changes can I make locally within my agency, but also within my family or my network? And then how can you get involved to make sure that we know what's going on, but also so that you can keep on track of what's emerging from the work that we're doing. So here are the next steps for me for the next little bit. The leadership team is an open invitation to anybody. We meet quarterly, and there are right now about 75 partners on that list. They don't all come to the meeting. Don't think you're coming to a meeting that's got like 75 people in a room. That's not what happens. Like any given time, there's 25 or 30 folks who come to meetings. We have an evaluation and analysis working group that's working on the framework around indicators, both internal indicators of success for SPRP, but also external impact assessment for the 12 bold ideas. That next meeting is the 30th. We have a lived experience action team. We're currently building a community of practice around folks to have a barrier-free network and opportunity to share their stories and get connected to other work. And then we have a series of new action teams up and running. So we have an implementation team that will do some awareness. We have a social enterprise and procurement team that's not meeting on July 25th. It's meeting later in August. We have a deeper dive into the relationship between social determinants of health and health delivery systems. So for all the health folks who are interested in that work, you can get connected to us. We have an income and asset building team. We have a transportation team. I have currently now 3 students working on community projects that are tied to this. One of them managing the lived experience team, and the other 2 are looking at policy intersections, particularly around quite often people will share policy with me and I think I know where it came from, but I actually don't. And so we're trying to mine all the policy documents to see whose policy it is, when it was input or when it was created and how it's being implemented. And then I spent a lot of time just doing learning opportunities. So if there's something that you heard and you want me to come and chat, then I will do that. I did a big HQC staff meeting. I can do public events. This is part of the awareness piece. And you can get connected to us through Facebook, Twitter, and my Gmail account. And that's it. Thank you much.
Perfect. Thank you so much, Colleen. As you mentioned, this is the second chance that I personally have the opportunity to hear you speak on this topic. And I remember the first time, I think we went over by almost an hour because we were so engrossed in the topics and we just kept asking more and more questions. It's a really, as you mentioned, complex and gnarly and vicious, constellation of factors that feed into this. And you do such a lovely job of engaging both the heart. My brain has I've been writing notes the whole time and taking away even more, having heard this the second time, thinking about it through a different lens or a deeper lens. But also engaging the heart and doing that job of balancing both of those and understanding the faces kind of that are being impacted by the policies or represent some of these stats that we look at. So thank you for bringing your experience and your knowledge to us. I see that questions are already coming in. We're excited to be able to have Colleen for a few more minutes. So I invite you to share your questions in the chat. So let's get started with some of the ones that are coming in already. So since the 12 Bold Ideas document was released in February, do you have a sense of the initial influence and impact its messaging and findings has had, and at what level?
Yeah, so it was my hope I hope there's no evaluation and analysis working group members on this call. It was my hope that we would have that framework built. It's interesting, we had an evaluation team meeting before we even had a 12 Bold Ideas document concept. Even the concept was barely alive. But now, because it's so complex, we're having a hard time managing the indicators and the eval piece. And I think that piece will be done hopefully by September. So we'll be able to do a little bit of a check and balance in September. But anecdotally, I've had some really interesting conversations with what I would call high-level decision makers within systems say to me that they've taken the documents to staff meetings or they've taken it to strategic planning sessions and have redefined sort of conversations around the language that they use and how they may not see themselves in poverty reduction sector, but now see their sector as one of the levers in creating change around people who are having a hard time making ends meet. One in particular that sticks out for me is the Saskatoon Police Service and the work that's going on to talk specifically about evidence-based policing and community-based policing and the role that safety and well-being plays in creating a community that doesn't have poverty, but also the role that justice and policing plays in perpetuating cycles. And so for me, there's been a handful of those kind of quick wins where people are like, oh, we've never really thought about it through this lens, and so now we're interested in figuring out what that looks like.
Wonderful, thank you. So a question that came through a different area of the chat. Do you have an idea of the status of other areas of Saskatchewan? As a provincial government representative, policy changes need to be reflective of the broader province too. We've learned from our former health regions that 12 policies on the same topic weren't an ideal state. Yes, we see
Yeah.
the pressure points through and through, it seems, right now.
Yeah, so I mean, historically the SPRP was focused on provincial. None of the things that we talk about in the 12 bold ideas are solely a Saskatoon issue. Like Saskatoon for the province is a hub for northern communities and reserve communities, and we realize there's a relationship between Saskatoon rural and remote, but also Saskatoon and the rest of the city and the rest of the province. And there's a relationship between the two big cities in our province, Saskatoon and Regina. And so we were aware when we were building it that we didn't want to build something that couldn't be taken and manipulated and created in a different context in a different part of the province. But I agree, like there's no need in this province of such a small population in the grand scheme of the world to have 100 different policies on the same thing. And a lot of the systems that we're talking about are provincial in scope. And so while we're talking about education sector from a Saskatoon specific context, there are lots of opportunities across the province to look at dismantling and disrupting colonial industrial school models that are already actually happening. There are pieces of it happening, but there's no policy from the province to look at that. And in fact, the legislation around education creates barriers where school divisions are forced to ask for leniency or memorandums of understanding to break the confines of that legislative agreement. And so my big question when we're doing this is why? Like, why can't there be more flexibility for local context to deliver the program and service that is needed for that space, particularly when that program and service or policy is evidence-based and rooted in what's in the best interest of whatever service or provider that, or whatever recipient that is receiving the service. I don't know if I answered. It'd be interesting to see, like, I'm in the cusp of the world of health too, right, because I have lots of health folks that work with the team, and what will happen over the course of the evolution of the single authority versus the multiple regions.
Thank you. I know that one of your calls to action for the broad group was to kind of read through the 12 bold ideas, internalize them, and then look in both their professional and personal lives to see what levers they might have access to and how they could contribute. As the majority of our participants are from kind of the healthcare sector, I know that you had mentioned kind of one idea of a poverty screening tool as a potential kind of lever for action within that sphere. Do you have any other kind of particular or specific calls to action for folks in healthcare to contribute to these ends?
Boy, you should have told me that question beforehand. It's like 10 minutes and I have to think off the cuff. Well, I mean, health is such a complex system, right? And so the thing is that, and health, particularly with children, is often the first contact to the family. And so what is the role of health in providing sort of, and not really a no wrong door policy, but kind of a no wrong door policy, in creating a coordinated access to services? But also, I've had the same conversation. I was just talking to someone in health about housing and releasing to nothing, right? It's not necessarily health's responsibility to suddenly become a housing sector provider, but there needs to be some kind of transition piece so that big sectors and big systems know where they can go and how they can get access to things. And then from a provincial government perspective, what are the policies and practices put in place so that those gaps are filled by a service of some kind or access to a service of some kind. So, so the housing one is interesting, right from health. We have a person with lived experience who shares a story around getting air ambulanced into Saskatoon for service, gets the service, goes through the healing process and is released, but is released to nothing, like has no way to get home, has no family necessarily in town other than the ones that came in to support him while he was here. And so how do they get home and if he's alone, how does he get home? We also have situations where policy prevents local agencies to provide service because the service is being provided in another agency within the province. For example, someone came into town and needed access to shelter because they got left here by family by accident, which happens, right? Things happen. I left my phone today. Things happen. And he just needed access to shelter for short term, and so, but he has shelter service and shelter funding in another community, and so he's not entitled to have 2 shelter service allocations, even though he just needs it for 3 days emergency sheltering in Saskatoon. But because he's sheltered and funded for shelter in another community, he's not eligible for shelter service, so shelter funding here. And so then the onus is on community then to absorb that cost or to turn him away. And if you turn him away, where does he go for 3 days? He'll end up in system somewhere, but which system will he end up in? And so my call around big systems who have these kind of policies and practices in place is that if you're not providing some kind of transition piece, they'll either fall back into your system at the more expensive end, so emergency service, or they'll fall back into an expensive, new, different service, corrections or whatever. And so I think looking at the way your system, when the mandate ends for the service that you're providing ends, what's the next piece? What's the connection? You don't necessarily have to be the one that provides it, but you just need to be aware of what it is. Yeah.
And that's a topic that's been front of mind, I think, definitely over the past number of years within the healthcare system, a lot of focus and attention on the idea of transitions, right? So within the healthcare, but I think that the time is right for us to think about transitions outside of the healthcare as well. What does that handoff service look like to either back to the community or to other services? Mm-hmm. So thanks for planting some seeds and helping us look at our work in new ways. Also a great segue to our next presentation that we have coming up in September. So before we let you go, we do have a lovely speaker gift of some I Love QI socks.
These are awesome.
So if you too, folks on the call, would like to get your hands on some of these highly coveted speaker gifts of I Heart QI socks, we invite you to sign up to be a featured QI Power Hour speaker. So Caroline's just sending out the link below. So if you have a story that you think our community would be interested in hearing and you'd like to share, we invite you to sign up to become a speaker. In terms of our next QI Power Hour session, we will be taking a break for the month of August, but we're back with a related topic. So Colleen talked about the various dimensions of poverty and the complexity of the issues. And came at it from, the equity and the social justice perspective. And the reality is that there's also a financial cost to the topic of poverty. So Charles and Colleen have worked together in the past and have fed off of each other's work. So in September, we'll welcome Charles Plant from the University of Saskatchewan for him to share some of his work around calculating what those costs of poverty are within our home province of Saskatchewan. So in 2014, the Poverty Costs Saskatchewan campaign calculated these costs and rallied public support behind our province's first provincial poverty reduction strategy. And in this webinar, Charles will present on why the costs of poverty are so important and describe how they're calculated. So we invite you to join us for this session as well, and we've provided the link to register in the chat. And so with that, we'll wish you a happy Thursday. As Colleen mentioned, she is available to be reached by email or some of the other social media channels that she's outlined. So if you have some questions that are burbling, but you didn't quite get to posting on our session today, we'll invite you to connect with her after the session. So we wish you a great rest of your week and look forward to connecting with you again in September. Thanks, everyone.